Good evening once again. I'm Keith Ranford, and welcome to our 7 Eyewitness News COVID-19 Town Hall. Our goal here over the next 30 minutes is to get you some answers to your questions about the vaccine rollout process here in Western New York. And to help us do that today are Dr. Nancy Nielsen. She is the Senior Associate Dean for Health Policy at the University of Buffalo Medical School and also the lead of the Western New York Vaccination Planning Team. Also joining us tonight is Dr. Raul Vasquez of Urban Family Practice here in Buffalo. He is on the front lines in the battle against this virus every single day. Thank you, both of you, for joining us tonight. Now, we've received a number of questions from people already sent to us through our website at WKBW.com. Our Ashley Rowe is also here with us tonight. She is monitoring your questions as they come in live on our 7 Eyewitness News Facebook page tonight. Ashley, we'll check back with you in just a couple of minutes and get some questions going. But let's begin tonight by playing part of an interview with Christine Schuyler, the Director of Health and Human Services for Chautauqua County. Here is what she told our reporter Ed Branch about her experience with the vaccine rollout so far. And Dr. Nielsen will get your reaction on the other side. Take a listen.
The bureaucracy in New York is such that the governor's chambers really seems to be guiding and controlling the pandemic response, including the vaccine rollout. And that's all well and good. They have the ability to do that. But at the same time, I'm really disappointed that there hasn't been a better partnership and a better respect and for an alliance with the public health officials, both at the state level as well as local health departments.
All right, Dr. Nielsen, we'll start with you. Your response as the representative from the state tonight.
Well, she has some very good points. There's no question. She is a remarkable county health leader, and she's been invaluable. The first thing we did in our region was
like, yeah, okay. She points to her toe. No. I'm like, oh.
All right,
because I'm hearing background noise.
Yeah, we have another.
So at any rate, she has been really quite remarkable. And the first thing we did in our region, Western New York, was to recognize that the county health directors have for years been the ones who've prepared for mass vaccinations. They've done it before with H1N1. And so they are the key members of the planning team for our region. But I will say that Christine has a very good point. Because the states that have done the best in terms of getting vaccine to the majority of their people more effectively than others have been the states that have had less micromanagement. So I have to say I would have to agree with her on that. Of course, there's a reason why it was done. It's a scarce resource. The state is trying hard to be equitable in the way that scarce resource is doled out. But I think we have learned to work together as best we can, and we are hoping for more and more vaccine quickly.
Well, hopefully it will get better from this point forward, although we also have to acknowledge this is a huge undertaking to get millions and millions of people vaccinated in a short period of time. Now, we know that registration opened up yesterday for the new mass vaccination site at the Delavan Grider Center here in Buffalo. 1,000 people will be vaccinated there a day, beginning next Wednesday, hopefully. Until then, the only state-run vaccination site here in Western New York is at UB South. And our I-team has learned this week that that location is now fully booked through the middle of April, April 16th. Now, Dr. Nielsen, can you tell us how many doses of the vaccine does UB South have right now? Is there a shortage, or are they getting what they need?
As far as I know, Keith, they're getting what they need. They were originally doing 500 shots a day. They then upped it to 1,000 a day, and I do believe that they have the supply to take care of that.
All right. Now, let's get into some of the questions that we've received here at the station. A lot of questions to deal with tonight. First off, this question from Marianne in Lockport. What is the recommendation for getting the vaccine for people who have already had the virus? Dr. Vasquez.
Well, you know, the recommendations right now is that you're going to go through the same protocol. So you need to get both vaccines. And there's been, they're looking at to see whether you may just get one shot, because the Pfizer one shot gets you 93%, it's 92% effective. But what we're doing now is, if you've had COVID, because we found that in other parts of the country, you have the antibody response even after COVID may come down. So just to be safe, you really should have your both shots.
All right, so
that way
even
we
if
know for sure that you develop the antibody response.
Okay, good to know then. Even if you've had it, you still have to go get your shots if you have not had them yet. All right, thanks, doctor. Next question tonight. Patricia in Buffalo says, I will be 80 in April. I do not have a car. And will the Johnson & Johnson vaccine be available at my doctor's office when it's released? Dr. Nielsen.
Well, we sure do hope so. This has been a concern for physicians all along. There are hundreds of physicians' offices who have signed up to be vaccinators. None of them have gotten vaccine. Dr. Vasquez has, because of a partnership that he has with Jericho Road, but none of the other physicians' offices have had any vaccine at all. Now, we understand in the beginning why that was necessary. It's scarce. And so if you want to get shots in arms real quickly, you want to go to the folks who know how to do that quickly. Doctors' offices see patients. They don't run vaccine clinics. They will when they get vaccine, of course. But so it made sense to get the shots to the hospitals to vaccinate their staff, and certainly to the county health departments to vaccinate the others. But now that they've opened it to people with underlying conditions, now it's really important that vaccine gets to doctors' offices.
All right. And also, there are still a lot of drugstores here in Western New York that do not have it. I know I spoke with one the other day. They say they put in an order every week, but they've never received any yet. Let's hope that things are speeding up and these independent drugstores will be on the list like the big ones are. Next question tonight. This is from Cheryl in Buffalo. She says, I have tested once per month ever since being diagnosed with COVID-19 back on December the 8th. Most recently was tested on February 21st, and it shows I am still positive. So my concern is if I can still be vaccinated, as I was told I had to wait 90 days from December 8th. Dr. Vasquez?
Yeah, no, I mean, the recommendation is that if you've had COVID, if it's been a 14-day course, you can get vaccinated. It's the retesting, because if you have COVID and it was positive, 30 days out, you don't want to be testing every week for that. You got to wait the 30 days. But 14 days after the diagnosis, you're able to get vaccinated.
And Dr. Vasquez, also, I heard, and tell me if this is right or not, that the peak performance of these drugs 2 weeks after you get your second shot. That's when you're most protected. Is that what you've heard?
Yes, the vaccine. And the CDCs are actually saying that after 2 weeks after your second vaccine, even if you're around someone that has COVID, you don't have to quarantine. Those are the CDC guidelines.
All right, Dr. Vasquez, Dr. Nielsen, stay with us. We have more questions for you coming up in just a moment. Also, Ashley, we'll check in with you in a moment, so stand by. Do you have a phone number?
Yeah, Keith, I got to tell you, there are a whole lot of questions coming in fast and furious on our Facebook Live right now. Dr. Nielsen and Dr. Vasquez, I've got them for you on the other side of the break.
Also, as we go to break, we want to give you that state vaccination hotline number to call to try and make an appointment if you can. It's frustrating. It may take you a number of weeks, but you have to try each day. It's 1-833-NYS-4-VAX, V-A-X. That line opens 7 days a week from 7 a.m. until 10 p.m. 7 Eyewitness News continues in just a moment. We are back once again, and welcome back to our 7 Eyewitness News COVID-19 Town Hall tonight. We are joined this evening by Dr. Nancy Nielsen, the lead of the Western New York Vaccination Planning Team. Also with us, Dr. Raul Vasquez of Urban Family Practice on Niagara Street here in downtown Buffalo. A lot of questions coming in on Facebook, so let's check in with Ashley once again. What's the latest?
Well, Keith, we have been streaming this broadcast live on Facebook, and as a result, we have got a lot of very thoughtful questions coming in. Here is one. Perhaps this one can be directed to Dr. Nielsen. This comes from Stephen Mannion. How do we know the long-term effects of this new vaccine technology? And he's referring to the mRNA vaccine technology.
Well, thanks very much, Ashley. And Stephen, it's a good question. It is a new technology. Unlike other viral vaccines, this does not inject a virus into you. All it does is it stimulates your own body to make antibodies against the spike protein, which is how the virus gets into our cells. So we have no evidence that there's any long-term adverse effect of this. We don't expect any because it doesn't alter your DNA. It doesn't inject a virus into you. So we think that this is going to be a really safe technology.
Another question comes in from Dale. Oh, sorry, go ahead. Did you have another response there, Dr. Vasquez?
One of the things that you have to, because so what we know is after the second shot, if something's going to happen in terms of a side effect, you usually see it 30 days out from that time. After that, pretty much you don't see the effect. So I vaccinate a lot. So if we give the flu shot and we're going to see something, usually 30 days out is when you see that. So if you're over that window, the likelihood, because like Dr. Nielsen said, this doesn't contain any type of virus. It's just a protein with a lipid covering. It's pretty safe. I mean, I've been vaccinated. I've got both my shots, and it's just through a sequence that we try to educate people that you have COVID, 28 million cases, 500,000 people that die. You have that bucket. The other side too that's real important. If you get COVID, you're going to have long-term complications from COVID, versus 66 million people that got the vaccine and we've had no bad outcomes. So I try to make people understand the benefits of it. But when I took the vaccine, we did homework. Dr. Nielsen, we don't just walk into a place and get vaccinated. My wife, my 2 daughters were vaccinated, and I wouldn't do that without doing the homework. So it's really important to understand, as professionals, we really want people to understand that we're just tricking the body. It contains no virus in it.
Thank you so much for that response. I do have another question. This one comes from Dale Federico. And I'm sure, Dr. Vasquez, you get this question asked to you a lot as you are vaccinating on a daily basis. How long does the vaccine protect you for?
So this is the thing. We've given 2,300 vaccines. And so we're learning. Right now we know after the second shot, 3 months out, that we have the effect, and we're constantly watching. But the idea here is we're tricking the body into making what are called these beta cell antibodies, and with the second shot, they become a little longer active. We're hoping, and the data is showing that for now we know 90 days, but it's going to be 60 days, a year, maybe 2 years. But it's only it's basically looking at the research and the studies to get a better view. But for now, we definitely know 90 days out. It's going to be longer than that. But we're following the data, which is real important to make sure that people understand that that's how we're making our decisions.
Okay, and one final question, and maybe I'll pose this one to you, Dr. Nielsen. This one comes from Cheryl Hannah. She asks, if you are allergic to antibiotics, any antibiotics, is it safe to get this vaccine? And perhaps we can broaden that out. If you have any bad allergic reactions to things, is it safe to get the vaccine?
Well, the simple answer is yes. It absolutely is safe. Allergies to foods, to antibiotics, to other medications are not a contraindication for this vaccine, and you're not going to get an allergic reaction just because of that. The people that we worry about are the people who've had really serious allergic reactions, what's called anaphylaxis. life-threatening reactions. I happened to have one of those once. And so what happens with people like me, when I got my vaccine, you wait for 30 minutes instead of 15 minutes, because if you're going to have a reaction, it will occur in that time frame. But it's really, really important that people who have other kinds of allergies not think that they're not eligible for this vaccine. They really are. If you have had a very serious allergic reaction like anaphylaxis, please talk to your doctor.
Very important. Thank you so much for all of your advice and for your responses. Sure, go ahead, Dr. Vasquez.
And Dr. Nielsen, and I agree, I totally agree, but so we've given it to 100 people that have had anaphylactic reactions. The idea is just tell the person testing so that they know they're going to watch you more, they're going to move you for 30 minutes, but out of the 100 people that we've given that have had really bad outcomes, that carry EpiPens, we've had there's been no reactions out of the 2,300 people that we gave the vaccine. So just to let people know so they can just guide you through the process. But please get the vaccine.
Thank you for your responses. Keith, I'll send it back over to you.
All right, thanks, Ashley. We're going to get some more answers to your questions for you when we come back. 7 Eyewitness News continues in just a moment. Don't go away. We are back once again trying to get some answers for you about the COVID-19 vaccination situation. Let's get right to it, to our panel of doctors. Here's one for you, Dr. Nielsen. Debbie from Orchard Park says on February 15th, Governor Cuomo expanded the vaccine eligibility to include those people under the age of 65 with comorbidities. Now, CVS and Rite Aid maintain that you are not eligible to get a vaccine in their stores unless you are 65 or older, per New York State regulations. So where is the confusion here?
Well, she's not the first one to be confused, but it's actually pretty simple. The state has said the pharmacies are a distribution channel that will vaccinate people 65 and older, and they're limited to that. So somebody under 65 with comorbid conditions should go to either the state-run MassVax site at UB or the county-run clinics or an FQHC, for example, and hopefully their doctor's offices once the doctors get vaccine. But she's right. So you need to understand the state's been very firm about who can vaccinate whom.
Okay, so the
we wish it were a little less stringent, but it is.
The drugstore is taking the people 65 and over and the other people to the state-run places. Okay, right. Kathy in Orchard Park has a question. When the eligibility finally opens up for the rest of the general public out there, will you still have to schedule an appointment, or will there be a walk-in accepted vaccination? And when do you think this is going to open up to members of the general public, Dr. Nielsen?
Well, I think it's going to be summer when that happens. And I think you are still going to have to make an appointment because it really is very important that this be tracked, that we make sure that everybody gets 2 shots if we still have the vaccines that require 2 shots. Now, Johnson & Johnson may get approved this coming weekend, and that's a single shot, as you know. But I think you will need an appointment. If you go to your doctor's office, it depends on whether you go in for an office visit or whether you just go for the shot, but you're going to need to make an appointment.
All right, Dr. Vasquez, maybe you could handle this one. Do you have to have health insurance in order to get this vaccine? What are people doing when they come to see you?
Well, what we've done is if we've taken people with or without insurance, I think if they have insurance, we use it. If they don't, we still give the vaccination. So we're not limiting.
And then are you reimbursed by the state then or the feds?
No, but at least some of the CARE Act, so we're private offices, so the CARE Act allows you to write this off. So if there's costs attributed to it and you don't have insurance, we're just writing it off.
Okay,
which is something we couldn't do in the past.
All right, people don't have to worry. Whether you have insurance or not, you can go in and get that vaccine if you qualify.
Let me add on to that, Keith, if I could. He's absolutely right. This vaccine, there should be no charge to a patient for this vaccine. The person administering the vaccine, whether it's a pharmacy or a doctor's office or a hospital, if the patient has insurance, they can bill the administration charge to the insurance. And I believe the insurer or the feds will pay that, but no patient will pay any copay or anything. And so whether you have insurance or not, I hope you all have insurance, but whether you do or you don't, it's not a barrier to getting this vaccine.
All right, doctors, thank you very much for joining us today. I wish we had another half an hour, but unfortunately we are out of time. Thank you again. I hope we've answered some of your questions out there. Maybe we can do this again in the coming weeks. That's it for this special edition of 7 Eyewitness News at 5:30, but don't go away. 7 Eyewitness News at 6 begins in just a moment.